I call Jackie Doyle-Price.
Thank you, Sir Mark, and it's a pleasure to serve under your chairmanship this afternoon. I wish I could say it was a pleasure to follow the Honourable Lady, and it actually genuinely is, and I've enjoyed working with her on this subject for quite some years now. But it isn't actually a joy to follow in this debate, because it's frustrating that we are still having the same discussion. In fact, it feels a bit like Groundhog Day since the, how many, 4 years it is since I ceased to be the minister responsible for this. But she reminds me that one of the reasons that I started moves towards the Women's Health Strategy and established the Women's Health Task Force was exactly because of the stories that she tells. And it was very clear to me when I was starting to look at these subjects. Ultimately, all the female members of Parliament that are present here have all had terrible experiences at the hands of the NHS, and we are very good at looking out for ourselves. And if that's happened to us, then that's something that's been repeated to women up and down the land, and it's something we really must properly address. And at the heart of what she's talking about, it is the whole principle of informed consent. And informed consent is the underpinning principle which sits underneath our NHS. But the stories that she's outlined this afternoon show, frankly, negligence about consent. It shows women being referred to what is actually an investigatory procedure, not a treatment, without any proper consideration of to what the women need to understand before consenting to such a procedure. And the truth of the matter is, as she has explained, is that women find themselves undergoing a procedure in terrible pain before they even know what's even happening to them. And frankly, in 21st century Britain, that's just not acceptable. We have made a lot of progress in terms of centering women when it looks at health, and ceasing to just treat them as walking incubators for babies. We are human beings. We do need to have our needs properly considered when we consent to treatment. We now have a women's health strategy, which shows we've made some progress. But this particular procedure, hysteroscopy, I think has not received the attention that it deserves, because although I think approximately 2/3 of women who have this procedure probably go through it with less pain than some of the cases we've heard about today, 1/3 of women do experience terrible, terrible pain. And the fact that that isn't properly explained to them is frankly appalling. And I've heard of cases where basically women are just told, take some paracetamol before you come down, be no problem. For those women that do experience pain, as she has outlined today, it is very, very severe. And so we must make sure that we've got proper, well-understood protocols that govern how this how this procedure is managed and how women are engaged in it. She draws the parallel with mesh, and I think that's absolutely right, because again, the whole issue of informed consent was missing in many of those cases too. And what you found was that the mesh treatment was being routinely recommended to women after childbirth. Women were not having any risks explained to them, and then lo and behold, they're suffering debilitating problems for the rest of their lives. And I think as we roll forward with the Women's Health Strategy, I think we really must stress test exactly how much information we are giving to women so that we can make informed consent an absolute reality. And the truth is, our wombs aren't just here to incubate babies, they are part of us. And, the women here have all been through, we all have to go through invasive examinations internally, and they're not very nice experiences. And I don't know about anyone else, but when I ever have to do that, I have this out-of-body experience where I kind of zone out of what's happening to me. And for these women, they can't do that because they're suddenly visited with terrible pain. They can't zone out of the fact that somebody's fishing around between their legs. They are living that, and that is an absolute trauma, a trauma that will stay with them for the rest of their lives, notwithstanding the other side effects that they have. Now, the Women's Health Strategy has alluded to some of this, but I don't think really has taken up this issue with sufficient seriousness. It talks about the need for conversations about pain relief before hysteroscopy procedure, But I think it needs to be a lot more than that. I think people need to be given sufficient information to decide whether or not they even want that examination. And I know that, you know, it's as many as 10% of women who suffer with problem periods and fibroids and the kind of conditions which would lend them to having such an investigation. But, you know, actually we do need to be able to make that informed choice as to, is it really going to make a difference? I mean, frankly, if you're 71 years old, what difference is it going to make? All you're going to do is establish the cause of what's causing the bleeding, when actually you might be better off just managing that condition. Because if there's going to be no end treatment following it, the whole thing is absolutely pointless with a substantial degree of risk. So I'm pleased to hear that the Royal College of Gynaecologists is updating its best practice guidelines. But I'd also like to invite the Minister to consider inviting the Women's Health Ambassador, Leslie Regan, to give a proper stress test of everything around this. I had the pleasure of working with Leslie when I invited her to co-chair the Women's Health Task Force. And she brings considerable expertise, and also as a gynaecologist who is a woman. Because the truth of the matter is there are far too many gynaecologists who are male. And with the best will in the world, I just don't think they are ever going to understand, let alone care, about the degree of pain that's being administered to them. So I'm really pleased with that appointment. I know Leslie's a fantastic advocate for women's health, but I would like her to properly look at this so that we have a good set of ideas, advice and principles to help women make informed choices, but also to make the medical profession understand exactly what difficulty this procedure does involve for some women. And I'd also invite the Minister to actually generally put this against some advice about healthy periods generally, because, you know, women need to be encouraged to take ownership of their own gynecological and menstrual health. But again, they can only do that with sufficient information. And, you know, we won't avoid a situation where women find themselves rocking up to a hospital for an appointment, then all of a sudden the next thing they know they're on the trolley in stirrups without properly understanding what's happening to them, unless everyone understands what good menstrual health looks like, what the alert factors are for some of these conditions which might invite a hysteroscopy as an examination, and then for them to understand what potential treatment they might be following that. And I think, again, the Honourable Lady has outlined the painful experiences that some of her people have had. But I think we all need to understand exactly what's involved here. Because what a hysteroscopy is it is an internal examination of the womb. And that examination is undertaken by the insertion of a camera through the cervix. Now, we know from the evidence that she and I have examined that women who haven't had children are particularly affected by pain. And if you think about what actually that procedure is, it seems to me a no-brainer, really, that it would be obvious that women who haven't had children would suffer more pain. So, again, I kind of can't get my head around the negligence with which women are referred to for this procedure without proper consideration of what their pain... Yes, of course.
I just want to emphasise, based on the experience of my constituent, this aspect that I was told that our leaflet doesn't mention that the procedure can be stopped if the patient is unable to tolerate this. And I wonder if the Honourable Lady can think of another medical procedure which is run without anaesthetic on that basis, that it can be stopped if you can't tolerate the pain, because there aren't many other examples, are there?
No, and the interesting thing is, in theory, you should be able to stop anything, because informed consent should be about that. And again, it just illustrates the relationship that we have with our health service. We naturally defer to medical professionals. We assume they know better than us. And perhaps this is where we need to alter our relationship, because actually these are human beings, they're not gods. And actually we need to be empowered to take more agency and ownership of how we approach these things. And, you know, listening to the Honourable Lady's description of Julie with removing her hearing aids. I mean, there is no way she was in control of that situation. And, you know, again, how can you have informed consent and the ability to stop something that's causing you significant distress and trauma in those circumstances. So, and as I've mentioned, it is extremely painful, especially to those women who've not had children. We know that some women are just told to take paracetamol before they arrive. And we also know that there is a massive discrepancy from organisation to organisation when women try and exercise the ability to have the choice of having a general anaesthetic. In some cases, the women are told absolutely that's not really the best thing for them. In others, as we've heard, that elective choice was made quite easily. And what that brings to me is a real worry that, again, too many of our medical establishments aren't giving their patients the respect that they deserve. And that's something I think that we really need to change the culture within our NHS. And this is all about, it's all about behaviours, ultimately. And we need to look at how we can encourage better behaviours towards patients throughout the system. In the short time I have left, I think I'll just make some specific asks to the Minister. And I've mentioned that I'd like to invite Leslie Regan to properly stress test this. But I think what we need is a proper risk assessment tool for each woman who's undertaking this procedure, so that they can make, that both they and the medical professionals that they're dealing with can make an informed choice as to whether they are more or less likely to suffer the substantial pain that's been outlined here. I also invite her to consider the work of Baroness Cumberledge in First Do No Harm, because one of the themes that ran through that work, and again I've mentioned MESH earlier, was this absence of informed consent. And one of the conclusions that we drew was that you actually need a proper patient's voice here to be able to stress test those incidents where there is widespread poor practice within the NHS. Because ultimately the NHS is a producer-driven system. It's all done on, we have care pathways which are very much process-driven, not practitioner-driven or patient-driven, frankly. And so we have to help the practitioners to help themselves by empowering patients, because you actually need to have that mutual understanding on the same level. So I would invite her to properly consider that establishment of a patient commissioner, so that we have somewhere to refer these incidents of widespread poor practice, because what we've outlined today, and the serious harm being done to women who are being put through this procedure without appropriate care, is doing real harm. And if we are going to have an NHS that works for all patients, we need to address incidents like this extremely quickly. Thank you.
Okay,